What's up, Ninja Nerds? In this video today, I'm going to be teaching you guys how to do an ultrasound guided IV. We got Kristen here, she's donating her arm. She stuck me, my turn to stick her. All right, it's only fair. But the question is why do we do ultrasound guided IVs? It would be because maybe Kristen wasn't able to access the IV via palpation, even though she's really good. Maybe it was just a little bit deeper, she couldn't feel it, the patient's a little bit dehydrated, and you're just not able to cannulate that via the palpation. Ultrasound guidance is nice because it helps us visualize a vessel, to see how deep it is, and to see if it's a good thing that I can actually target with my needle and guide myself and the needle down into the vessel so I can see it entering into the vessel, and I can even see my catheter being advanced into the vessel too. So that's one of the nice things. So it's a little bit better for those deeper vessels, the ones that you can't see. And so we're gonna go ahead and try and give that a shot today. So we're gonna have Kristen get comfortable here. And what I'm gonna do is I'm gonna get the tourniquet on. We're gonna get Kristen comfortable here. We're gonna go ahead and take and get this tourniquet on. And why I like to do this first before I even start sticking is I wanna find the best vessel to target. So I get the tourniquet on and I wanna take a look at all the different vessels here, see which ones are gonna be nice, not too deep. I don't want them to be greater than 2 centimeters. It might be too far that I won't have much of the catheter to thread. And I look for them to actually be a good straight length. So I don't want them to be tortuous. I look for about less than 2 centimeters deep, then at least a 2 centimeter straight path, not tortuous. So I like to take a look here first. So I'm gonna use my butterfly IQ. I'm gonna have Kristen record it for me so you guys can visualize what I'm seeing here. And what I'm gonna be doing here is I want my probe, here's my indicator, the blue top here, right? So whenever you guys are using ultrasound, make sure that you have the indicator. It should be pointing towards the left. So on mine, you'll actually see like the blue circle there with the B on it. That's gonna be where the indicator is actually situated here. So right away, when you guys see, you see like these two little, like you see this structure here, this like bifurcating. If I compress them, they collapse. Those are veins. So I'm gonna slide up and I see them actually completely come together here. So that's the basilic vein. And I wanna follow the track and look at that. Look at the side there. It's less than 2 centimeters deep. And it stays straight for about 2 centimeter length. So this is a good vessel I'm gonna cannulate. It's actually nice and decent size. That's one thing. It's not too deep and it has a good straight path. I just want to go above the bifurcation and I want to see if it bifurcates at all up here. And it bifurcates there. So I have a pretty good distance here that I'm going to be able to thread the needle down and then push my catheter in. I think this is going to be the one I'm going to target. So yeah, let's go ahead and get her cleaned up and we're going to go ahead and get started on here. So let's go ahead. We'll pause that. Okay, we're going to pop the tourniquet, give her arm a little bit of a breather. And we'll go ahead and clean some of this jelly off here. Okay, so we're gonna put this tourniquet back on. Sorry, Kristen.
That's all right.
And what we're gonna do here is we're gonna just get it nice and clean. So you can use the ChlorPreps. In this situation, I like the ChlorPreps. And I'm gonna be kind of targeting a big area here. So I want to clean as much of an area as possible just in case I change my mind and go somewhere different. So nice and clean there. All right, after I've done that, I'm going to have my needle. You can use different needles. I'm just going to use an 18 gauge needle here. And what I'm going to be trying to do here with this is, again, following that same kind of path. All right, here we go. So as you guys can see here, I'm just going to turn her arm a little bit more here. Again, you see that bifurcation there? I want to go just above that and stay straight for a nice distance. So I'm going to start right here. Okay? So you're going to feel a little poke here, Kristen. Ready? Mm-hmm. And poke. And what I'm doing is I'm trying to find my catheter here with my ultrasound. So I'm going to bring it right close to the ultrasound. You see that I'm kind of just banging on the top of the wall here. And now I'm actually in the vessel. You guys can see that I'm in the vessel here. I'm going to kind of just lower my angle a little bit and keep kind of advancing. Because what I want to do is, I want to see this bullseye in the center here throughout the entire length until it disappears. So you guys can see it's there, right? So now what I'm going to do is I'm just going to slowly thread my catheter, and then I'm going to have my retractor there. So you can see how there's blood here. I got nice return of blood. We're just going to go ahead and pop this tourniquet here. And we're going to attach on our tubing here. And I'm going to pull back blood. See how they pull back blood? And I'm going to flush it. Do you feel any pain there?
Nope, feels good.
Okay. So that is going to be nice and in there. So I'm just going to go ahead and detach this part here. I'm going to clean this up a little bit. Get all that ultrasound jelly nice and cleaned off. It's one of the banes of existence for the Tegaderm. All right, so we got our catheter in. We're going to go ahead and secure it now. So we're going to go ahead and take our Tegaderm here. And Kristen's probably judging me so hard right now because I'm not very good at these. Usually when I put any IV in for a patient, I'm like, hey nurse, you want to put this on for me? But we're going to get it all kind of taken care of here and she'll give me any advice. All right, so we got here that part of the Tegaderm down. Make sure you clean that ultrasound jelly off. That can sometimes be a problematic issue there with getting these things to stick. Okay, then we're going to go ahead, put that down over the top. And there's our IV. If you want, you can take some tape and tape that over this part here. Some people will do that. I don't know, do you like doing that, Kristen?
I use that this little piece actually, right?
Oh, look, she uses this piece here.
Then you can document time and your little initials.
So we're going to do that now. We're going to put this bad boy on here.
Why not?
And I'm just going to put down. Zach Murphy, the boss, put this in. All right. But Ninja Nerds, this is how you do an ultrasound guided IV. I hope it made sense. I hope that you guys liked it. I hope that you guys learned a lot. And I hope that now whenever you guys are out there on the wards and you guys are doing some IVs, you'll take a little stab at this. No pun intended. All right, Ninja Nerds, as always, until next time.